My name is Dr. Henry Fabian. I'm an orthopedic spine surgeon. I was born with parents from Germany, both immigrated here in the late 50s, early 60s, and so I kind of grew up with that whole European work ethic heritage, and it's been something I've worked through or worked with my whole life. Came back to Cleveland, again to home, and practiced privately there for 8 years before seeing an opportunity to move out to Colorado and out to Steamboat. And we came out here in August of 2004. I'd run the Ohio Spine Institute, which we'd started back in Cleveland. I'd been head of that for 8 years and been very successful in building a program there, and we did the same thing in Steamboat. When I got to Steamboat in 2004, they had not performed any surgery on spine. By 2 to 3 years later, we were doing probably 175 cases to 200 cases a year. And it was a very common procedure done at the hospital there, and it's grown, and we've taken care of a lot of patients through that center. You know, it sounds cliche, but the most enjoyable part of my practice as a spine surgeon is helping people. I mean, I guess I could get some satisfaction out of the design work we do with new implants and new surgical techniques, but the focus there is always swings back to think, well, how is this going to make it better for the patient? How is it going to make it easier for them and their families to recuperate and rehab? The fellow, we had a girl from Tibet that had been abandoned essentially by her family and brought from a couple from Boulder, brought her back to Denver, and the girl had a 140-degree curve to her back, which basically meant that when she was sitting on an exam table, her rib cage almost was on the table. And we did surgery on her, and she gained about 5 to 6 centimeters of height in one procedure, and dramatic improvement. And the first time she got out of the bed and walked, and the look in her eyes was just something that you don't get paid for that.